All right, welcome back to the program. As I said earlier, we will be looking at update around coronavirus, Lassa fever. I did tell you at the beginning of the program that there are a lot of economic implications to diseases or disease outbreak. Of course, for those of you that have been monitoring the show, that have been following me for a long while, there's always a cost implication to everything. And it's time for our conversation. The man at the helm of affairs at the NCDC, the Nigeria Center for Disease Control, Dr. Chikwe Ihekweazu, is here with me. He's the man in the midst of all this. Welcome, Doctor. It's good to have you on the program again.
Thanks, Nancy.
Long time no see. How you doing?
Well, it's a very busy period, like you can imagine, but we're on top of it.
Now, speak to me about the coronavirus. Let me start. Is it in Nigeria?
We haven't found any case in Nigeria so far. We've set up architecture to be able to detect this. We can, labs here in Abuja, if there was to be a suspect case right now that would come into Nigeria that fit the case definition, we can right now take a sample, get that sample to the National Reference Lab, and provide our Port Health Services colleagues an answer in 4 to 6 hours on if that's the case or not. So we haven't found a case yet, and we're confident in our ability to detect this if there were to be a case that fitted the case definition.
Okay, I'll come back to our preparedness a bit later. But explain to people what coronavirus is, really, so that people will understand what exactly it is.
Yeah, so this is a new type of coronavirus. Is actually a group of viruses, of which there are a few. SARS, MERS are all types of this virus that have previously jumped the species barrier from animals to humans. So from time to time, there are lots of viruses that are circulating in the animal world. And from time to time, one could skip and start infecting humans, depending on contact. So this is really what has happened in China. Sometime in December, there was this skip from animals to humans. We're still to find out what animal it is. And then transmission starts in humans. And so this is a new type of coronavirus. What we know about it at the moment, there are two important variables with which we describe any virus. One is its transmissibility, i.e. its ability to move from one individual to another. The other is about, we call it the case fatality ratio, the number of people that die if they were to get this virus. So for now, what we know about this virus, it seems to be fairly transmissible, but the case fatality ratio, the number of people that die from this virus, is about 2%, and we think that will even get less. So I think the key point for Nigerians at this stage, this is a new virus, and with any new virus, there's a lot of anxiety, but it is definitely not the killer virus that is being reported in some aspects of the media.
It's not a killer virus as of now. Does it mean that if one is infected with coronavirus, then you can get better?
Yes.
With treatment?
Absolutely.
Because I understand it's like it has flu-like symptoms and all of that. Does that mean if you're infected now with coronavirus, there's a likelihood to get better?
So right now, over 80 to 80% of cases would have a mild flu-like illness. What's a flu-like illness? A bit of cough, catarrh, sometimes a bit of fever. You might not even need any hospital admission at all. This is 80% of cases. Another 16% would have fairly severe symptoms, i.e. would require hospitalization. Below, just about 2% have passed away from this. 2% is an unfortunate proportion, but it's very low compared to many other viruses that we know about. So most people will recover without any problems at all.
Because as at Wednesday, there were 490 cases reported in terms of death toll.
Yeah, that's...
Yes, but the infection still, that's the spread is still rising, it's still spreading, over 20,000 of them. So are you saying that is negligible? Because I understand what you're trying to say in terms of the mathematics of it.
So I'm not saying it's negligible by any stretch of imagination. This is an important new disease that has emerged in China. As we speak, 99% of all cases have been in China. Chinese authorities are working extremely hard to get this virus under control, to get this outbreak under control in China. And the principles of outbreak control are to control it at source. We've had some exportations in about 20 countries right now, but no sustained transmission in any of those countries. So we're working very hard to manage this situation. It's a new virus, but we mustn't take our eyes off the ball of real problems that we're dealing with every day in Nigeria: malaria, TB, Lassa. And so while we keep our eyes on this new virus and make sure we learn as quickly as possible, it's also important not to take our eyes off the ball from present challenges we have to our health security in
So
Nigeria.
with what you said earlier, there's no case right now in Nigeria. And I think, at least as of now that I'm doing the show, no confirmed case in Africa yet.
Yeah.
Because I was I was watching a program on TV, and Nigeria, Senegal, and 2 other countries I've forgotten in Africa, we actually, praised in terms of these are countries in Africa that have labs, so to speak, to take a look at it. Now that leads me to preparedness. How prepared are we?
So I think really this is something we've been preaching about. You don't prepare for war when the war has started, right? I think the great thing Nigeria did around the time of the Ebola outbreak is actually set up this new center that I'm privileged to lead, the Nigeria Center for Disease Control, where we have a group of people that work 24/7 really to make sure Nigeria is prepared, both in terms of laboratory preparedness that you just mentioned, having stockpiles of response commodities, having rapid response teams that can deploy in hours. But, having said that, I would also add that we are not getting the investments that we need to protect our health security. Many aspects of the economy can do a lot more to support our work. Right now, we have an outbreak. Many members of the private sector are getting in touch with us, asking for advice and what they can do. A few months ago, I was reaching out to all of them to support the work that we're doing in order to prepare for an event like this. We hardly get any response in those times, and that is really when we need the help. Now there's an outbreak, everybody is excited, everybody's looking for support from NCDC, but when we reached out to the same players in peacetime, it's thought about, okay, it's not our problem. So it really is to balance, have a sense of balance that, this is also a risk to business, to the economy, to the country. And just like for every other thing, we also have to set aside some investments to put into preparedness so as not to be caught napping when there's an actual outbreak in front of us.
Now, I'll still come back to that preparedness in a while, but let's talk about what preventive measures are on now against coronavirus. Is at the airport? I haven't been to the airport in a while. At our entry points and all of that, what are the preventive measures? So
absolutely, the key aim of a goal of our strategy at the moment is to prevent this virus from coming into Nigeria. So we learn, one aim is therefore, one activity is to learn as quickly as possible about the virus. So we have a coronavirus preparedness group at NCDC that is constantly reviewing new evidence as it's coming out. With that evidence, we are then advising our frontline health professionals. So if you come into the airport, any of our major airports at the moment, you will see an intensified screening at points of entry, especially the airports. All the thermal cameras are working both in Lagos and Abuja and other airports. And if the camera picks you up for having a fever, you're then called aside into a secondary questioning area and you are asked about your travel history. There are no direct flights from China to Nigeria, so we have to elicit that history from people coming back, ask them, if you're coming from Ethiopian Airways, where did your journey originate from? Emirates, Lufthansa, whatever other airline comes into Nigeria, they can come from any part of China. So we ask secondary questions. The third strategy is to really advise Nigerians. And you would have seen we've sent out 3 public health advisories in the last week or so, really advising anyone that has come back from China that is well on arrival, because not everyone will have a fever as they're walking through the airport. If they're well on arrival and then get ill, and they know they've been back from China within the last 14 days, to call us on our toll-free number, which is available on our website and all our advisories. And we will then come to you to collect a sample, because we don't want people going into hospitals ill with this virus. Hospitals are great amplification sites for viruses. So we will take a sample, we'll get it to the lab, test it, and if it's not corona, reassure you. If it is, advise you on next steps. So we have set up rapid response teams to do exactly this. So there are lots that we've put in place to ensure that we protect ourselves as much as possible. But final point, Nancy, even if we do have a case, it's really not the end of the world. We have setting up plans right now as we speak on what to do to mitigate the impact of this new virus if someone were to have it in Nigeria.
You know why I'm asking that question? Because we need to be careful, not just careful. We know the peculiarity of our people, so to speak, because some people will be like, okay, I'm feeling sick. You will just be going up and down. You go to the marketplace, you go everywhere with it. Further explain to me, because I think I saw, was it on your website, where you said, if you have coronavirus, isolate yourself. What does that isolation mean? Because I interviewed a private sector person last week, the MD of a carrier asset, and he also raised that issue. That let's say you're coming back and you didn't feel sick but you now feel sick at home, you should isolate yourself. That was not, too good. So expatiate on that.
It's very simple. It's just that in many other diseases, the advice we give is go to a hospital. So if you have fever, you think it's malaria, we always tell patients, listen, go to a hospital and get tested. And so people are struggling with the advice of stay at home. So this is not really, when we say self-isolate, we're not saying cover yourself in waterproof or anything like that. We're just saying stay at home, right? Don't let your wife hug you, your children play on you. Stay in your room and call us, and we will come to you, get a sample taken and send it for testing. The key thing here is, have you come back from China in the last 14 days? Really. So we're not asking anyone with a cough or flu or fever to start calling NCC. But really, the critical thing, do you have a cough, flu-like illness, shortness of breath and all of that, and the fever? Have you been to back from China in the last 14 days? Then you meet our case definition. Then we're ready to deploy resources to support.
Let's talk about health security. Now, I had an interview just a few months ago, I think in November. Shewonik Bije of Budget and Sarah Maka of One Africa. Just let's take a look at it and listen.
As a country and as people, we try to apply reactive measures to everything. And in the end, because when emergencies happen, we don't have structures to even manage them. We find out that we, in our own view of budget, either when it was flooding or either way where it was Ebola, we find out that we spend so much with so little accountability. And so there's so much wastage. And you're even trying to jump all the rules. You're trying to say, okay, we can't go through a 45-day procurement cycle. We need to get this going now. So we're seeing all that space. But I feel like prevention for us is about saving money, it's about saving lives. And because you also don't know the scale of what it could be. Look how very lucky we were with the Ebola. I mean, in terms of the guy coming in through an airport, he could have just walked through a Benin Republic border, and before you know, and he fell down in Orile, and 100 people tried to touch him and say, oh, this is what happened. And so in terms of the way that we need to think through more about, we want to save more lives of Nigerians, and we also want to save much more money. Because I see that times when things come up in emergencies where we have not prepared, there's so much wastage, there's so much corruption. You think that people are trying to solve the problem or trying to mitigate the issues, but everybody's trying to still make much more cuts for themselves. And that's the way I see it from a fiscal prism, that it's better we put structures in place to prevent issues. This will happen.
Sarah, you want to come in there?
You know, one of the things about epidemics is that it really takes away all the gains we make on economic development, our GDP growth, trade, tourism, foreign direct investment. Yeah. We saw what Ebola did to the countries of Liberia, Sierra Leone, how much their GDP fell.
And they've not recovered.
And they've not recovered. So what we're trying to say is, having a response to the epidemic before it happens actually saves us not just resources, but also our own future, right? So how do we set up labs in states? How do we address cholera, smallpox, monkeypox, Lassa fever within states today? So tomorrow, we're not, as Sheo mentioned, running helter-skelter, reactively. We're responding proactively.
Yeah.
And I think that's really what we're here to talk about. How do we proactively respond to these things today?
Doctor, that was the show I had just 2-3 months ago, as if I knew something like this was going to happen in terms of we need to prepare. What's your response to that?
So I couldn't have put it more articulately than the two colleagues that you had on. You know, I think for once in Nigeria, the Nigerian government needs to actually be recommended because they have invested in setting up NCDC. They've put some money behind it. We've recruited some staff. We're training our teams. But, you know, health security is not the government's problem alone. It's a whole society's problem. And, you know, I do think we have to broaden out this premise that government will solve all our problems, you know, and really bring entire society, the private sector, not-for-profits, our religious bodies, social organizations, into focusing on health security and working with us. And we've actually been reaching out to groups to say, listen, everyone can help. You know, if you have a logistics company in Nigeria, you can help us move things around the country, provide us warehousing for stockpiling. If you have a telecommunications firm, you can help us with making communication easier for us, reducing what our colleagues, we have surveillance officers in every local government. We have to buy airtime for them, data packages at commercial rates for something that's a social service. So any of the big telcos in Nigeria can come up and say, listen, let me just I'm not giving you money. Let me subsidize your communication costs because that communication will help save our company. So these are the things we're really looking out to support from the entire economy to support us in building our capacity to protect the country.
Let's go back a bit to Corona before we come to Lassa fever. Do you think that coronavirus will get to the pandemic stage? Because I know there are stages. Do you think so? Or it's already pandemic?
No, it's not yet a pandemic, but this is really a critical time at our response. You know, China can be criticized for many things, but one thing they can absolutely not be criticized about is the response they have provided for this outbreak. You know, they've gone over and beyond the call of duty in terms of what they're doing. As far as we can see, you know, some of the videos have been shown online in terms of the hospital, but there are many other factors and response measures. So really, the key thing is, can we manage this outbreak at source as much as possible? And if we don't, then we start talking about mitigation. But we're still in a phase of trying to contain.
Contain it. Why the upsurge in the number of cases of Lassa fever? Why is Lassa fever still there? Because Lassa fever, we've been having it in Nigeria, at least with the little knowledge that I have. Perhaps it probably originated from here, who knows? But why have we not been able to contain it?
Yeah, so Nancy, I remember a great video you showed in one of your previous shows.
I think I'll show it again if there's time.
On Lassa, you know, Lassa, the challenge is that the host animal is a rat, right? And this virus doesn't kill those rats, so it circulates among rat populations. And as long as rats have access to our foods, we will continue to have Lassa until we have the tools like a vaccine to interrupt transmission. So we keep, you know, when you see, I saw my neighbor somewhere close to where I live at the moment, and there was a bit of rubbish on the road, and I saw him, you know, walking home, stepping over that rubbish and going into his house and thinking, okay, I have avoided the problem. No, you haven't avoided the problem. As long as we ignore those things that attract rats into our homes and our neighborhoods and think that we can build our walls in a way that to protect ourselves, it doesn't work. So we have to keep doing the things that we can do to prevent rats from getting into our neighborhoods. But there is some good news, Nancy. You know, this year, yes, we've had over 300 cases already,
yeah.
more than we've ever had by this time of the year. But the good news is that we've had much fewer deaths. So we've have, up to date, 47 deaths. So we've reduced the case fatality ratio for Lassa in Nigeria from about 24-25% to about 15%. It's still a lot of people.
Yes.
47 is a lot. But really, we're getting better at detecting. We're getting better at providing care. People are coming in earlier for treatment. So the system is working. And the best news is that there is a vaccine now that has gone into phase 1 trials. And we're working with the partners abroad to develop trials in Nigeria, because you can only try a new vaccine where the disease is happening. So we're going to...
Just like the coronavirus
yes,
vaccine
absolutely.
is tried now.
Yeah, so we're going to start trials for that vaccine in about a few months to a year, and then see whether we have a new tool in our arsenal against this virus.
How many states have Lassa fever now?
So at the moment, I think we've confirmed the case in 23 states. So it's definitely
that's a lot.
It's a lot, but 70% of the cases are still around 3 states: Ondo, Edo, and Ebonyi. But I don't want to stigmatize these states. These states, what is actually happening is the doctors in these states now are aware that there's Lassa around. They're sending their samples for testing. We're testing, providing them results. So. We're really encouraging doctors everywhere to trust the system. We have 5 labs now that are able to diagnose Lassa. We have an arrangement with a private courier company that we have trained to collect those samples from any state capital in Nigeria to take it to the lab. So we've made it as easy as possible for Nigerian doctors to diagnose patients. But, there's a lot of skepticism about the system, especially the public sector in Nigeria. So we're really urging colleagues to trust the system. We can provide you that diagnosis. You know what your patient has, and then you can provide appropriate treatment.
Is NCDC working with the 3 states, particularly Ondo, Ebonyi, and Edo State, those 3 states, particularly since we have higher rates there? Are you working with the governments of those states to actually know why we have so much prevalence in that state?
Yeah, so we're doing a lot of...
And perhaps other states too, because like you said, 23.
Yeah, no, we're working with all state governments, especially these 3, because, they understand the burden. And actually, the governor of Ondo State was really being encouraged. He's provided a lot of resources for the response and is now being very proactive in leading the team to understand the circumstances, supporting local governments in clearing refuse, especially in the Owo area. So there's a lot of work happening, but this is a marathon, Nancy. There's no magic bullet here. We just have to keep at it and make sure that we continue preparing and responding.
Is there a period of the year the outbreak reemerges or disease rises? Because even from my own little observation and research,
it's always the first 3 months.
3 months of the year.
And this is thought to be an ecological factor around when food gets scarce for rats because of the change of weather in their normal habitat. So everywhere becomes dry. They start looking for food in other places, start going into homes and things like that. And it's if you look at the charts, we produce charts every week, updated data on Lassa. And every single year we've had a peak around between January and March.
The surveillance to reduce the endemic nature of Lassa fever, how strong is it? Since we have it in 23 states, what surveillance tools or what surveillance measures are you putting in place to help reduce it? So that now that you know that it's always happening the first 3 months of the year, can we be better prepared?
So this is really one of the Lassa surveillance architecture for Lassa is probably one of the most developed for any of the diseases, and probably one of the most developed in the world. The challenge now is, to set up a new lab for Lassa. It's a molecular lab. It's a fairly complex setup. Apart from the procurement of the equipment, you have to train the people in a very specific skill. So it's not plug and play. It costs a lot of money, about 150 million naira for a single lab, and a lot of training. So what we're doing is we're up to 5 now. Our goal is to keep increasing this and get people trained in the diagnosis, develop a supply chain for the reagents, get more Nigerian private sector involved in some of these commodities that we need in the labs. And then we get it to flow. And the easier it is for a doctor, a healthcare worker to send a sample, the easier they will do that. The more likely it is that they will do that. When it's complex, people think, okay, let me just try this treatment. If it doesn't work, I'll try the other one. But we're telling colleagues, listen, that trial and error can lead a patient to lose his or her life, actually. So send us the sample, we will provide you the result. And with that, we will also improve our surveillance and knowledge about the disease.
How much threat is perhaps Lassa fever or perhaps some of these epidemics posing to the economy? Because when I was even studying on my own, I realized, for example, Lassa fever, if we take a look at perhaps processing companies or even these states which we've talked about, most of them, which country in the, which state in Nigeria doesn't eat gari, for example? So you can see our processing system, people would even want to shun gari in the market. Yeah. That's an economic implication. Absolutely. That's just the tiniest, so that people will understand what I'm saying, so that people don't say you're talking health. Everything has an economic implication. So what are the threats, especially to the Nigerian economy, around epidemics, around perhaps when it grows to the pandemic stage? What do we need to do? Perhaps if we sound that these are the threats, people really understand what we're saying. Because people look at it, it's just like it's health or it's just you. When it affects that person, it's just the person.
No, so I think the bigger threat with outbreaks and epidemics are really the disruptive nature. People forget that during the Ebola response, schools were closed for 2 months. So imagine the impact of that on our education calendar. Of course, we've caught up, but we don't want that to be happening. Our kids were at home. Instead of being in school, we kept them at home. So outbreaks can be very disruptive and take away resources from all the development efforts that we're making. But this is also our biggest challenge at NCDC, is that, it's hard for politicians, our political leaders, to take credit in prevention, because it's hard to go out to your campaigns, as our leaders do, and say, because of my efforts, I prevented 3 outbreaks. So it's kind of difficult, a difficult sell. But we're really encouraging everyone, listen, what we want is for companies, the economy, CBN, everyone, every actor in the Nigerian economy to go to bed at night and sleep, reassured that if there was to be a problem, that there's a group of Nigerians working 24/7 to keep them safe. But for us to get to that stage, we really need to think about our response before the outbreaks, and make sure, just as we set aside some funds to provide fire extinguishers in our home, check the tires of our vehicles before we travel, it's the same way we have to invest in our health security before there's an outbreak, not after.
How about the budgeting? What does your budgeting look like? I know I discussed it in November or so, and my guest also did canvass for perhaps more financing for the NCDC to ensure health security. I know you are wearing the hat of a public official now, but but what would you like to see?
So, there's no doubt about it. To provide health security in Nigeria, we need to invest in it. Government has increased our funding to some extent, but really we need to really scale this. I mean, to give you a comparison, NCDC has 250 people working for it. The US CDC has 15,000 people working for it. It's a slightly bigger country than ours, but not that much bigger. So if we want to really get serious about health security, we need to put some more money behind it. And we're not asking for money to be thrown at everything, because our work is actually very difficult. There are many things that money can't solve. It takes a longer term investment. But beyond government, Nancy, my key message today really is that this is a whole society responsibility, and especially corporate Nigeria. They need to see the potential impact of this on their own bottom line. And yes, in some cases it might be possible to for 1 or 2 people to fly outside the country, but firstly, there's no guarantee that it's better anywhere else. And secondly, you can't take everybody out of Nigeria. So we all have workforces here that we have to protect in Nigeria. We have to ensure that we think about each part of the economy thinks about itself as part of a bigger picture, and everyone put something behind this. So I hope my phones are on. I hope that I'll get a lot of calls from people asking, listen, how can we help?
Okay, just as we finalize the program, let us go back to coronavirus, which again is, everyone is talking about it around the world. The last time I checked, about 26 countries have cases of coronavirus among developed and mostly even developed developed nations. But perhaps why we're also looking at it is because they're adequately prepared. We've taken a look at what is happening in China, not just one hospital, 2 hospitals actually, within a week or within 10 days, however you look at it. What and what can we do now, perhaps as individuals, to prevent it? And, you know, your final word.
So I think I'll end by just going back to prevention. You know, the things we can do to prevent corona, even if we don't have corona, will prevent a lot of other diseases. So the things that we preach about that people trivialize. So when we say we need to wash our hands all the time, you know, I've gone to schools in Nigeria, hospitals, where you find a great building, you know, they must have spent millions on infrastructure, but there's no running water. You know, you go to the bathrooms of schools where, you know, so we have to go back to the basics and really focus on providing the facilities and ourselves using those facilities to prevent the transmission of these infections. The thing with corona is, unlike Lassa, Lassa requires body fluids to be exchanged one way or the other for transmission to happen. Corona is a respiratory-borne virus, transmitted through droplets. So it's a whole new perspective altogether. So we really need to wash our hands, cover our mouths and noses when we're sneezing. And if we're ill, stay at home, you know, don't be the hero and go
stay at home and call you guys.
Well, if you think it's corona, but if you have a flu-like illness, even if it's not corona, you shouldn't be at work being the hero, hugging everybody, kissing everybody, and transmitting that virus to your whole work environment. So there's a lot that we can do ourselves to prevent the transmission of infectious diseases. And, you know, hygiene, the basics, wash your hands.
Doctor, I want to ask you this, since you're a medical doctor, how about doing like this now? If you don't find a handkerchief or a tissue paper, is it healthy to
Yes, it's absolutely better. The reason is our hands are such non-conscious transmitters of viruses. So it's much better to sneeze into your elbow. At least you avoid your hand. So the next person you see, and you know, we're social people.
But since it's airborne, wouldn't it spread that way?
You know, it's airborne, but it's not, it's transmitted by droplets, so they can't go that far, right? So we're not saying the ideal thing is to have a tissue and after that throw it away and wash your hands. So we're just saying that it's better to sneeze into your elbow than on your palms. Because the challenge with us, there are cultures where people don't shake all the time, you don't hug all the time. But in Nigeria, we do this all the time. And if you don't do it, it's seen to be offensive. So if you know you don't immediately have access to water to wash your hands, it's much better to sneeze into your elbow than into your palms.
Okay.
The ideal thing is to sneeze into a tissue paper, throw it away, and wash your hands.
Yeah. Okay. One thing coming to my mind just before you go. Should we just take a look at those coming from China? How about, are we also tracking those that are coming from the countries where they have cases? Because we know as Nigerians, we're even travelers. Not just, okay, if you're coming from China, stay there. But are you coming from US? Which area of the US have we confirmed? Are you coming from Nepal, from Vietnam, from Singapore, from Hong Kong, from Australia, and all of that? Yeah.
So it is a very important point, and an important point for your viewers to understand. So this is why we're monitoring the situation every day at NCC. At the moment, it's only in China where we have sustained transmission. Yeah. So all the cases in all the other countries you've mentioned have either been directly from returning travelers or people that we know had contact with one of those returning travelers. Exactly. So there's no ongoing transmission. But this can change at any point. So we're continuously monitoring the situation. You know, the countries at most risk are those in Asia where there's a lot of traffic to and from China, Hong Kong, Korea, and all the countries around. So we're continuously monitoring this. And if there's a need to change our advice, we will do so. So I need Nigerians to trust that we are out there to protect them. And you know, follow us through any of our media channels. And if our advice has to change, we will immediately change this and make it available to them.
Why am I always asking the last question? Okay, this may be the last. It's like there are more questions coming out. Is temperature check just enough? at the entry point? Is the thermal check just enough?
So
Is it just enough? You're a doctor, you know what I mean. Yeah.
So it's a balance, with what we have to do. Our response always has to be proportionate to the risk. At the moment, we're not just doing thermal checks. We're also asking a couple of screening questions. Port Health Services is about to introduce a new form for returning travelers so that we ask them about their travel history before they land, and so we can check some of that. We're providing them with information on who to call if they were to fall ill afterwards. So that's really a spectrum of activities we're carrying out. If it becomes necessary to be more aggressive, we will. But at the moment, from our understanding of this virus, the science, and our ability to respond, we are confident that we're doing, we have a proportionate response to the virus.
All right, thank you very much, Doctor, for coming.
Nnaji.
I know you're very busy this time, so I appreciate you for finding time to come speak to me.
Thanks a lot.
Thank you very much. All right, I've been speaking with Dr. Chikwe Ihekweazu, the DG NCDC, that is the Nigeria Center for Disease Control. We've been looking at the issues around coronavirus, Lassa, why you need to, take a look at some measures so that you don't contract some of these infectious diseases, not corona now, just normal hygiene, and the economic implications. Like I said, there's a cost to everything. In fact, if you are dancing, there's a cost to it. Call me, I'll articulate that for you. All right, that's the much we can take on today's edition of the show. Thank you for being a part of it. Be the best you can be the change you want to see. I am Nancy Nnaji. Bye now.